When selecting the correct ultrasound parameters, there are specific steps that you want to follow in order to choose the correct treatment. This chart here helps give us a really good representation, a visual representation of how we're going to choose the parameters for the ultrasound. The first thing you want to start with is the impairment. What impairment are you trying to treat? So it's either going to fall into the category of soft tissue shortening or delayed tissue healing and prolonged inflammation. Depending on that, you're going to either choose thermal or non-thermal effects. Thermal effects are primarily used for stretching the soft tissue that's shortened. It's going to increase blood circulation and increase the extensibility of the tissue due to a contracture, lack of mobility, or pain that's going to limit function in that tissue. Non-thermal effects are going to alter membrane permeability and accelerate tissue healing. So once you've decided what the impairment you're treating is, and you understand what thermal and non-thermal effects of ultrasound are, then you want to follow the diagram down here. I know it's backwards, but we'll have to go with it. So if we start with the soft tissue shortening, we decided that we're going to use the thermal effects. The thermal effects, like I said, are going to bring heat to the affected area that we want to treat. And the heat like I said, is going to increase extensibility and increase blood circulation. To achieve heat, you want to do a duty cycle of what's called continuous. So it's continuously radiating heat, and it's going to produce the thermal effects that you need to promote healing and stretch out the muscles. From there, you want to decide how deep is the problem that you're treating in this category here. Is it shallow, 1 to 2 centimeters, or is it deeper than that, 3 to 5 centimeters? Based on the depth of the structure that you're trying to treat, you select the frequency and intensity. Frequency and intensity are inverse relationships, so if you have a higher frequency of 3 millihertz, you want to choose a lower intensity of 0.5 watts. And the same thing, if you have a deeper problem, you go to a lower frequency with a higher intensity of 1.5 to 2 watts. So based on that, you want to go all the way down to duration of treatment time, which is the same for both, which I'll talk about after we talk about this column. So if you're trying to promote healing and you're trying to increase tissue healing, you want to choose the non-thermal effects. The non-thermal effects are going to give you heat, but in a pulsed rate. So you choose a duty cycle that means pulsed. So it's giving you heat only 20% of the time that it's on. So it's on an on-off cycle. So every 20% it's on, then it's off, then it's on, then it's off. And that's what gives it the non-thermal effect. It's not producing heat. So based on that, we do the same thing. We want to decide what the depth of the problem is. Is it shallow or is it deep? If it's shallow, we're going to do the same thing. We're going to go to 3 millihertz. And if it's deep, we want to go to 1 millihertz. The difference with non-thermal is that the appropriate and the studied wattage that you want to use for the intensity is going to be the same either way because it's not producing any thermal effects. So you want to use 0.5 to 1 watts of energy. So once you've decided all of these factors for both non-thermal or thermal effects, you want to decide what the duration of treatment is going to be. So all treatment for either thermal or non-thermal is going to be 5 to 10 minutes and 2 times the effective radiating area, the ERA. So once you've decided that, the ERA is the part of the transducer head that's actually producing the energy and has the healing effects. So 2 times that area, 5 to 10 minutes is going to produce the most appropriate treatment for ultrasound.